In today's video, I want to talk about 8 hospice care myths. When you hear the word hospice, what goes through your mind? There are so many myths and misconceptions about hospice care, and what happens is it's stopping careblazers like yourself from being able to take advantage of an amazing resource sooner rather than later, and I don't want that to happen to you. So in this video, we're going to clear up all of those myths that you've probably heard. You might have them yourself, and it will help you decide whether or not hospice is something to consider for your loved one. Oh, hey, Careblazer, real quick. Last week, I hosted a free class on how to successfully respond to challenging dementia behaviors, and over 800 of you registered. It was a huge hit. A lot of you are asking for me to do it again, so guess what? I am. I'm doing another free how to successfully respond to any challenging dementia behavior class. You can save your spot in the registration link below this video. I hope to see you there. All right, let's get back to this week's video. First, let's review. Hospice is medical care dedicated to improving the quality of life with somebody who has a condition that's not likely to be cured and will continue to get worse. Usually when people hear the word hospice, their mind goes to a place of somebody who is hours or days away from death. They might be picturing the person who is bedbound, laying in bed all day, probably in a hospital, and the family doesn't have very much time left. That is sometimes the case, and hospice is definitely appropriate in that situation, but it doesn't always have to be that way. The problem is so many people wait until the very last moments, very last days, very last weeks to bring up hospice, that's often what happens, but it doesn't have to be that way, Careblazer. Myth number 1, if you're choosing hospice care, it means you have given up on your loved one. I've heard this many times. In fact, I can remember a very sweet family where the actual patient thought it meant the family was giving up on them when the family was starting to ask questions about hospice. Hospice care is really dedicated to improving the quality of life for that person who is being considered for hospice care. What can be done to make life more enjoyable, more pleasant, less painful, more comfortable? It's not about giving up. It's about improving quality of life. And when you're improving quality of life, it means you get to enjoy more quality time with your loved one. Myth number 2, hospice care has to be provided in a hospital. That's just not true, Careblazer. Hospice care can be provided anywhere. It can be in the hospital. It can also be in the comfort of your own home. It could also be in a residential care facility like a nursing home or a assisted living facility. It's up to you, your loved one, and the healthcare team to decide what is the best setting to provide hospice care. In my 13 years of working in a hospital setting, the vast majority of people I've worked with have all received hospice care in their home. Myth number 3, if you enroll in hospice care, you have to get rid of your current primary care provider. That's just not true. When somebody enrolls in hospice care, they will get a healthcare team. And that healthcare team is amazing because they are going to be available 24/7. Now, that's just not something your primary care provider is likely going to be able to do. Your loved one's primary care provider is probably not going to be able to be available 24/7. That's what the hospice team is there for. But the primary care provider probably knows your loved one better than any of the other providers, and so they can work with the hospice care team to come up with the best plan for your loved one. Myth number 4, if you're on hospice care, you're not going to be able to get medical care or medical treatment for any other conditions that might come up. Careblazer, hospice care is about comfort, is about improving quality of life. And while there won't be any active treatments to help reverse or slow down whatever condition it is that got your loved one qualified for hospice care, it is possible your loved one can get medical treatment for other conditions. For example, if your loved one with dementia qualifies for hospice and is on hospice care, but then got a urinary tract infection, they're going to be treated for that urinary tract infection. It's not like your loved one can never get another medical treatment ever if they're on hospice care. That's just not true. If there are other conditions that come up that are not related to that condition that got them to be on hospice care, they can absolutely be evaluated for treatment. Myth number 5, people who are on hospice care are about to die. Now, that myth exists because the majority of people wait way too long to ask about hospice care and to enroll in hospice care. In order to qualify for hospice care, you have to have a life-limiting condition that your medical doctor thinks you have 6 months or less to live because of that condition. So somebody can enroll in hospice care and have estimated 6 months left to live. So that's 6 months of care, of quality, great, total care from a wonderful healthcare team that your loved one can have, and you can have more enjoyable months with your loved one versus waiting days or weeks until it looks like they're about to pass to enroll in hospice. Myth number 6, which is similar to myth number 5, when you enroll in hospice care, you're basically about to die. That is not true. Like I said, people just wait way too long to ask about it and enroll in it. In fact, I have a study here. I want to read a little bit to you. So even though the myth is very strong that people die quickly when they're on hospice care, it's actually the opposite. The opposite is true. People end up living longer when they're enrolled in hospice care earlier. So, and actually, I just want to say from personal experience, I've worked with plenty of patients who were enrolled in hospice care, and then because of the amazing hospice care attention, the team, the focus, family education, all of the extra attention that person got, they eventually graduated off hospice care. So it's like that 6 months came up, and sometimes they were, re-enrolled, like they could continue in hospice care, but sometimes they got so much better that we just had to say you're off of hospice care now. Like, you don't qualify anymore. We don't think that you have less than 6 months to live, right? So that can happen as well. But here, let me look at these stats real quick. There was an article in the American Family Physician from 2018. It was called Life Expectancy in Hospice Care. And Careblazer, I'm going to try to link to this specific article for you below in the description. And the authors of that article, they talk about the differences observed between people who received a terminal diagnosis and either didn't enroll in hospice care, received 3 or less days of hospice care, or received 4 or more days of hospice care. So those authors found that people who did not receive any hospice care, on average, lived 6.1 months after the initial terminal diagnosis. Whereas people who received 3 or less days of hospice care lived an average of 6.5 months. And then those who received 4 or more days of hospice care lived on average 10.2 months, right? That's huge. That's a difference of over 3 months longer for people who were enrolled in hospice care longer, right? It doesn't hurt to ask your provider, hey, can we talk about hospice care? Is it appropriate right now? Is this the right timing? What are your thoughts? Myth number 7, all hospice care companies are the same. This is pretty obvious, right? Not all hospice companies are the same. Majority of my experience in the hospice companies I've worked with here in this area, they are amazing. Not all of them, right? Just like not all primary care providers are great. Not all psychologists are great. Not all caregivers are great, right? There's gonna be like one hospice company is just that. It's one hospice company. Do not judge all hospice care based on the story you heard from a friend or from a neighbor or from even a personal experience of your own. And finally, myth number 8 is that hospice care and palliative care are the same. Although those two types of care have a lot of overlap, they are different. Palliative care can be given alongside any attempts for treatment or curative measures to cure something, versus hospice care really just focusing on symptom management. Now that one, I want to tease apart even further because there's a lot of misconception about what is hospice care, what is palliative care. When people say them, sometimes they say them interchangeably. So next week's video, I'm going to go over what specifically is the difference. And so if you don't think your loved one quite qualifies for hospice care at this point, palliative care might be a better approach for them. Careblazer, I hope that this video helped you, and I'll see you next week. In the meantime, keep up the great work. Sending love to you all. Bye.